Welcome back. So, one question to pose to our audience is what uses could you use hypnosis for? What might be helpful in your life or in the life of those you love? So, Jeff, as we talk about this, we're here with Dr. Jeffrey Zeig, the head of the Erickson Foundation, who also does this amazing conference every couple of years, The Evolution of Psychotherapy. Does a story come to mind about how hypnosis has helped one of your patients?
Oh, many stories. There's spectacular cases. Like I can remember one woman who came to me and she was having episodes that were dissociative. So she would wake up in places in a compromised state, and there was blood, and there was knives, and there were very strange things like a little baby doll, and it was a rare case of somebody who had multiple personality. So and it hadn't been diagnosed at the time. So one of the first interventions was to put her in a trance and have a part of her to communicate using automatic writing. Now, at the beginning of 2020, you'll still be writing 2019. And if you're on a telephone call and you start doodling, it's automatic writing. So what we're doing in hypnosis is taking a facet that can happen normally in life and amplifying that to serve a therapeutic purpose. So I had her write out some of the messages from this part of her that was so aggressive, put them away, fold them up, put them in her purse, and read them at a time when she would find that she could absorb what the message was. In the meantime, as she's writing furiously, and I mean furiously, she's having a conversation with me and the co-therapist in the room and doesn't realize is completely dissociated from what she was writing. And then never did find that piece of paper. But over a couple of months of therapy, and part of it was to be hypnotic and to have her go into a trance and to go away, basically. Like we would say that there were a couple of facets with Sandy I and Sandy Y, and they were different facets of her personality until I could use hypnosis to understand the severe trauma that she had suffered and the fact that that trauma was repressed. And it had been an undercurrent that was guiding her life. Now, in 50 years of practice, I think maybe I've seen two people who fit the diagnosis of having multiple personality in the way that I believed. But the use of hypnosis and amnesia was important in helping her to integrate these fractionated parts of her personality and bring them together so that she could live in peace with herself and wasn't in disharmony with herself due to the fact that she had been so severely traumatized in one point in her life. So that was a use of deep trance. Now, when people come to me and they want to stop smoking or stop using internet pornography or gambling, I don't necessarily need to use a deep trance. You need to use the amount of trance that is necessary to help the person get the realization that they need. Of course, I can stop smoking. Of course, I can do a better job at monitoring my use of the internet, for example. So I don't have to do something that is so spectacular as a dissociative state, automatic writing, deep trance, but help people to realize what they already know.
So
Hypnosis can be like an amplifier in that regard.
And people have different abilities as far as going deep into a trance. Probably not everybody's hypnotizable. You have to have a little bit of an attention span. But I think my experience, I'd be interested in yours, it's about 85% of people can be hypnotized. But only, maybe 15 or 20% of those can go so deep that they actually don't remember what happened. My experience is most people remember what happens in a trance, but time gets distorted. It's almost uniformly a really positive emotional
For me, it
state.
is.
Unless control is a huge issue for them, and then they may not be able
I wouldn't
to
say
let it
control is
go.
not a huge issue for me, but I find it
I
an
would say
empowering.
actually it is a huge issue for you.
But I find it empowering, so that's why it doesn't bother me. Do you know what I'm saying? Like, I think it doesn't bother me because I find it an empowering tool. In fact, I used you to hypnotize me for my first black belt test many years ago, and it was so helpful for that. So for things like that, it was just, I was nervous about it. I was scared to do this test and didn't think I was going to make it through. And with the use of that hypnosis, completely changed how I felt going into that test and performed through the test. And I used it again for my second black belt test, which was much harder and I was terrified of. Used it again for that, and I literally felt amazing going through that test. So I really like it for uses that I feel are empowering, and I've used it for I've used it for pain and
performance enhancement.
Absolutely, but
I've
I've used it
worked
for
with
pain and
premier
medical.
athletes.
Yeah.
And the difference between being exceptional and being
Absolutely.
excellent is very small.
Yes.
And so premier athletes would come to me, and could they get into the mental state that they need? What is the IPS? What is the ideal performing state for taking your black belt test? Can we use hypnosis as an ancillary to helping people get into adaptive states,
Right.
and not just use it for something that's problematic, but using for something where you're enhancing performance?
Exactly.
Well, and so
I should
often-
say that relaxation, maybe in the last year, I don't even think I've used the word relaxation with a client. Hypnosis is traditionally thought of as like a psychological massage. Like the hypnotist is doing da 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 da, and the client is just, into a very passive state. But actually, the problem of hypnosis is activation, how to get people to activate and access the realizations that they need to be more adaptive in their life. The other thing I'd like to mention is that in California, especially, people can be licensed to do hypnosis, and that doesn't require any training at all.
Oh.
Being a hypnotist is not regulated in California. Anybody could put out a shingle and say, I'm a hypnotist. They could take a weekend workshop and say, I'm a hypnotist. And at the Erickson Foundation, we only train people who are enrolled in an accredited graduate program or have a minimum of a master's degree in the health or health sciences. Hypnosis is an adjunct that can be used. But if the person has depression or a bad habit, you could use cognitive therapy, you could use hypnosis, you could use family therapy, you could use Gestalt therapy, psychoanalytic therapy. Every therapist has a tool at his or her disposal, and I don't recommend that clients shop for tools, that they shop for a therapist. I wouldn't take my car to an unlicensed mechanic, so
Right.
I certainly wouldn't take my psyche to somebody who has a shingle like a hypnotist. So.
That's a good point. It's a very good point.
When I was young, I learned this technique called hypnoanalysis. Do you remember when that came out?
Sure.
So powerful. And
Yeah.
I remember a 16-year-old boy who came to me with a panic disorder. And I hypnotize him. His mother's in the room. And I take him back. And the technique is basically put someone in a trance, take them back to the last time they had that symptom, and ask them what they're thinking and feeling. And so it's, I can't breathe. And then in a trance, have them imagine themselves getting younger and smaller, smaller and younger, and go back to the first time that you couldn't breathe. And so he went back to when he was 4 years old and he had a piece of steak stuck in his throat and turned blue, and there was hysteria all around him until someone did the Heimlich maneuver on him. And he remembered hearing, "Oh my God, you're dying." And that had got cemented a little bit in his subconscious mind. But then I learned you can't go, you need to go back even further. So go back after they go to their, I think it was initial sensitizing event. Is there anything else when you can't breathe? And his mother's in the room. And he goes, it's dark. I'm wet. And something's around my neck. And I can't breathe. And his mother all of a sudden starts crying because he was born with the cord wrapped around his neck. Now, I don't know what people think about that, but as you then begin to plant you're safe, people love you, healing images, he never had a panic attack after that. And I found that bridging technique to be so helpful over the years. What's happening at the time you're having this symptom? When's the first time you had it? And go back even further if you can. Do you remember learning about that?
Sure, yeah. An affect bridge can be created around an emotion or an image or a sound, and you're just allowing the person to go back in time to this traumatizing event. And if you can go back before and you are providing somebody with some initiative that helps them to realize that they don't have to continue the debility that they've had, whatever it takes and however it is that you coordinate with the belief system of the client. And sometimes the belief system of the client conforms to the belief system of the therapist. But if people get better, whatever it takes to help people to get better, I'm for it.
So, but that also brings up, and maybe we can talk about it in the next podcast, is Brian Weiss's work, Many Lives,
Sure.
Many Masters, because he was a psychiatrist who accidentally, according to him, took someone back and they flipped into a past life. Stay with us.
If you're enjoying the Brain Warriors Way podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, feel free to give us a review or 5-star rating, as that helps others find the podcast.
If you're interested in coming to Amen Clinics, use the code PODCAST10 to get a 10% discount on a full evaluation at amenclinics.com. For more information, give us a call at 855-978-1363.